Bismillahirrahmanirrahim. Assalamu alaikum. This is Ikra Kausar. My roll number is BP1650091 from 5th Professional Morning. The drug I'm going to present is chlorpheniramine. It belongs to the class of antihistamine, first generation. The rational use of chlorpheniramine is sneezing, itching. The drug is used to treat contact dermatitis and drug eruption, watery eyes, running nose, allergic conditions, for example, hay fever and other allergic rhinopathies, urticaria, pruritus. It is used to treat acute and chronic eczema. The side effects of chlorpheniramine are drowsiness, dizziness, CNS depression, impaired reactions, dryness of mouth, nose and throat, muscular weakness, palpitations, vertigo. The diagrams are also mentioned here. Okay. Here is the dose adjustment of chlorpheniramine for adults, geriatrics and pediatrics. The oral dosage for adult is 4 mg every 4 to 6 hours and it should not exceed 24 mg per day. Sustained release is 8 to 12 mg every 8 to 12 hours and it not to exceed 24 mg per day. The dose adjustment for geriatrics, oral dose is 4 mg once or twice daily or 8 mg sustained release at bedtime. For pediatric, the dose adjustment for the children is oral dosage is 0.35 mg per kg per day in divided doses every 4 to 6 hours. The children of age 2 to 6 years, the dose adjustment is 1 mg every 4 to 6 hours and it should not exceed 6 mg within 24 hours. Children with the age of 6 to 12 years, the dose adjustment is 2 mg every 4 to 6 hours and it should not exceed 12 mg per day and sustained release is 8 mg at bedtime. The drug-drug interactions of chlorpheniramine are mentioned here. That is, with the CNS depressant, it may cause additive CNS depressant effect. With MAO inhibitors, it may increase anticholinergic effects of chlorpheniramine. With choline esterase inhibitors, chlorpheniramine may decrease the effect of choline esterase inhibitors in the treatment of Alzheimer's. CYP3A4 inhibitors, it increase effects of chlorpheniramine. If a drug is given with amphetamines, the drug interact with it and it may diminish the sedative effect of antihistamines. With the beta-histines, antihistamines may diminish the therapeutic effects of beta-histine. Chlorpheniramine also interact with some foods. For example, if we are taking it with alcohol, it can potentiate the CNS depression of alcohol. Here is the toxicity mechanism of chlorpheniramine, that how it basically causes toxicity. What is the mechanism? Normally, chlorpheniramine blocks the action of histamine because by blocking it we can we can prevent the allergic symptoms, as histamine is responsible for all these allergic symptoms. Chlorpheniramine is more likely to cross the blood-brain barrier. As a result, it can cause dizziness or drowsiness even in normal dosage. So, overdosage can be very toxic. The occurrence of this toxicity is more common in young children, and the toxic dose is about 3 to 5 times the normal dose. Okay, toxicity in adults. CNS depression is usually dominant reaction in adults, which is evidenced by the symptoms of drowsiness, lethargy, fatigue, hypnosis, and coma. Toxicity in children causes CNS stimulation, jittery, fast heartbeat. The children may experience hallucinations, seizures, coma, slowed breathing. So here is the irrational use of chlorpheniramine. The drug is used to treat insomnia, sleep disturbances because of its sedative properties, but it rapidly developed tolerance. There are so many patients who are taking antihistamines without the prescription of doctor because it is easily available in pharmacies. As a result, the patient experience a number of side effects because of the no adjustment by the doctor or the pharmacist. For example, dry nose, headache, dry mouth, drowsiness. The patients who are taking chlorpheniramine for longer period of time because of the lack of awareness, and which can frequently cause drug dependence as well as drug adverse reactions. Here are the alternative choices. I have mentioned here the 3 choices which we can use instead of chlorpheniramine. The first one is the Zydex cetirizine. It can be used instead of chlorpheniramine to treat sneezing, itching, watery eyes, allergic conditions. The second one is the Claritin, loratadine. It may be preferred over chlorpheniramine for treating allergies conditions. The reason why we are using these 2 drugs, the first one is that both of the drugs are the second generation antihistamine as that of chlorpheniramine, and they make the person feel less drowsy than chlorpheniramine, plus the dose is less, which is once a day. The body absorbs both antihistamines quickly, but Zydex seems to work faster for some people. Both the drugs considered more safe in breastfeeding women than chlorpheniramine. The third category, the third alternative choice I have mentioned here is these natural antihistamines. There are some natural antihistamines present which we can use instead of taking these medicines. For example, a common herb in natural medicines, stinging nettle, can also be given. Butterbur supplements used to treat nasal allergies. The reason is that we are using these natural antihistamines, chlorpheniramine, because they have lessened side effects than allergy medicines, that is chlorpheniramine. So here is the next slide. Okay, there are 3 alternative brands with high and low prices with respect to pharmacoeconomic point of view are as follows. The first one is the Allerphene with the retail price of rupees 25. The second one is the Histone with the retail price of rupees 58.5, and the third one is the Piriton with the retail price of rupees 287. The drug with least cost will have more pharmacoeconomics. So here among these 3, Allerphene is sold more as compared to the other brands with more cost. Okay, the next slide is the available dosage forms of chlorpheniramine. The drug is available in the oral dosage forms as well as in injectables. In oral dosage forms, we have tablets and liquids which are preferred when the short acting effect is desired. In capsule, the drug is preferred when long acting effect is desired. Okay, the second available dosage form is the injectables, in which we have intravenous route, and the subcutaneous route. Intravenous route is preferred when a rapid effect is desired, as in anaphylactic reactions. The intravenous route is recommended. And in the event of blood transfusion reaction, a dose of 10 to 20 milligrams of chlorpheniramine injection is preferred by the subcutaneous route. Here is the drug toxicity of chlorpheniramine. Toxic dose for chlorpheniramine. In general, the toxicity occurs after ingestion of 3 to 5 times of the normal dose, which is 20 to 40 milligrams per kg. And the toxicity of chlorpheniramine causes extreme sleepiness, blurred vision, confusion, weakness. The person may experience ringing in the ear, the pupil got larger, hallucination, flushing, seizures. So how we are going to manage this toxicity? What is the antidote of chlorpheniramine? Here we have the three ways by which we can manage the toxicity. The first one, we have activated charcoal. It is used in emergency situation to help reverse the effects of poisoning. It works by stopping the absorption of chemicals at the drug from stomach into the body. Along with activated charcoal, cardiac and respiratory monitoring must be there. And to control seizure, which is the effect of toxicity of chlorpheniramine, we are giving generalized benzodiazepines, in which we are giving diazepam 5 to 10 milligram intravenously, slow infusion. Here we are giving slow infusion because the fast or rapid infusion of diazepam can cause cardiac arrest and respiratory depression. Okay, and the second one, we are giving localized midazolam in the dose of 0.025 milligrams per kg intravenously, rapid infusion. Here we are giving rapid infusion because it is safe, there are no side effects. Okay, so here is the case study related to my drug chlorpheniramine. And there is a person, CG, is a 25 years, 5.7 feet tall man with a body weight of 70 kg, seeking a treatment for seasonal allergies which have caused itchy and watery eyes, running nose, itchy eyes or nose or throat, and rash for the past 2 weeks. He has been playing golf frequently and thinks pollen is causing the itchiness. CJ is looking for a short-term solution until the pollen count decreases. He takes no medication and has no past medical history. What should be the recommendation for the allergy? So here are the soap notes for this case study. With the letter S, we have subjectives, in which the symptoms include the running nose, itchy eyes or nose or throat, rash, watery eyes, and he has no past medical history. With the letter O, objective, age is 25 years old, the weight is 70 kg and the height is about 5.7 feet. The assessment includes CG is facing running nose, itchy eyes or throat or nose, rash and watery eyes, which are the symptoms of seasonal allergy that may occur several times of the year, usually when outdoor molds releases their spores, or trees, grasses and weeds releases tiny pollen particles into the air to fertilize other plants. With the letter P, there is the plan. In plan, we are giving recommended him non-pharmacological measures and then pharmacological treatment. In the non-pharmacological measures, ideally CG should try to avoid pollen or decrease his exposure to it, because exposures triggers the itchiness. So he should avoid it, and he can also try applying cold compresses, washing his eyes out with water when he goes indoors, and wearing sunglasses outside to reduce itching. Pharmacological treatment include the first line therapy and the second line therapy. First, we will go with the first line therapy, in which we are giving him carboxymethylcellulose and hydropropyl methylcellulose. Both of these drugs helps to wash out allergens and relieve symptoms. So here is the second line therapy. If the symptoms still persist, do not improve within this 72 hours by the first line therapy, then antihistamine chlorpheniramine with the dose of 4 mg QD must be given. Nasal corticosteroids can also be given to CG. So there is the plan for the patient. I hope it would be helpful. These are the references from where I have taken all the material for my drug. Thank you.